So all day we've been talking about how to establish a team, how to prepare your partners to provide the information that will help make your data team successful. Now we're going to take a little bit of a turn and think about what does it take to truly have a successful partnership with the private sector for data. We know that the public sector can't do it alone. It really does take a village to make things move forward. And that does include not only the private sector, but also nonprofits. And so we've established a really cross-experienced panel that will help guide us through this conversation. This panel will be led by Clare Epstein, who is our VP of Public Sector. You met her this morning when she kicked off this summit, and she's back to help lead this session now. For those of you that have questions, please put them in the chat. We do want to make sure that we can get to those questions. If we have time at the end, this is such an important topic. We want to make sure that we're supporting you on this journey. And so with that, I will turn it over to Clare.
Great. Thank you so much. Well, I'm really excited to be moderating this panel. We have some great folks on the panel. I'm going to give just a quick intro to them, and then we'll get started. So we have Dr. Nicole McKinney on the panel. Dr. McKinney is the executive director at Upstream. Upstream is a North Carolina nonprofit that works very, very closely with healthcare providers to reduce unplanned pregnancies. Also on the panel, we have Jenn Folsom. Jennifer is a vice president of growth at ICF Next. ICF Next is a private consulting firm that works closely with the government on numerous projects. And then we also have Pablo Pinto, who is a professor at the University of Houston. So really, we have three completely different spectrums of public-private partnerships. We have someone from a nonprofit, we have an academic, and then we have the private sector. So really excited just to jump in. I think, Nicole, if we don't mind, we could start with you.
Certainly.
But for all of us, the first question is just tell us a little bit about your organization and how you typically interact with government.
Okay, great. Yes. Hello, everyone. So we are actually a national nonprofit. We work in a couple of different states, but I specifically spearhead our North Carolina state project. And we work with health centers across the U.S. that are typically hospitals, health departments, federally qualified centers. And we work with them to really kind of interrogate their workflows, increase their billing opportunities for reimbursement, really try to drive practice change within those health centers so that we're able to help health center practitioners to provide really patient-centered counseling to women so that we're asking very intentional questions about when a woman wants to become pregnant or if she wants to become pregnant. So pretty central question that we ask. And then if that woman chooses to get pregnant, absolutely, we try to connect and ensure that she's connected to the best well care and health possible. But if she doesn't, it's really our intervention is really about equipping that woman with all of the contraceptive methods that are available to her so that she's making a very informed choice about when she'd like to get pregnant and choosing the method that works for her at that particular point in time in her life. And so we work with government officials in that regard. For North Carolina, for example, we kind of began our journey here by working with the Department of Health and Human Services Secretary. Typically, we find that states will have some type of initiative that's already underway that will align with this type of mission, where we're trying to increase choice. We're trying to mobilize economic opportunities for women. And so we usually start our engagement efforts by doing some kind of landscape analysis within the state and partnering with the government officials to really align with their strategic objectives so that we can really optimize that synergy around trying to promote opportunities within communities. That's really kind of where it begins for us.
Great. That is quite a lot there. Jennifer, kicking it over to you. Just tell us a little bit about your organization and how you typically interact with government.
Yeah, thanks, Claire. So I'm with ICF, and ICF is a big global consulting firm. We've about 7,500 employees globally in 75 countries, I think. We were started in 1969 as the Inner City Fund by a Tuskegee Airman. So it's kind of a cool founder story. And our founder wanted to make Washington, D.C. a better place to live and work and make the world a better place. So we always say we're a for-profit company with that nonprofit heart. And our real mantra is doing well by doing good. So lots of our work, whether it's IT, science, climate work, focus around some of those underlying social determinants of health and making the world a better place.
Great, thank you. And Pablo, last but not least, if you could tell us a little bit about your organization and how you interact with government.
Thank you, Claire, and thanks to Civis for inviting me to be part of this event. So I direct the Center for Public Policy, which is a research unit within the Harvard School of Public Affairs. So we approach this process of interacting with government and not-for-profit organizations and even individuals in different ways. One is by producing academic research, which is what we as academics do. So we use resources that we get from grants and contracts to build teams that approach problems that we believe are important in the public sphere. That's the first one. The second one is, it's like also our mandate is through training, right? So we have students that we train and in the importance of identifying patterns in the data, and many of those students eventually go to the public sector, work as officers in different agencies, or become analysts, and so that's a training program, and we build many programs on that with a specific focus on data analytics and using data that might be already available. And we also do a lot of outreach. We interact a lot with government and not-for-profit organizations in developing projects which are both on data collection and data analysis. We have a survey research institute that creates data on surveys for different agencies and organizations. And in many instances, we get approached by not-for-profit organizations who are interested in having access to government resources and try to identify what are the hurdles for accessing those resources. So we do, it's like we are an academic unit in a public university and in a school of public affairs. So our main objective is to be able to produce knowledge, analyze data, and help government and individuals and companies and have better access to public policy.
Okay, wow. So 3 very different organizations. Let's see if we have some commonality with the next question, which talks about challenges in working with government partnerships. And how do you navigate, and what advice do you have for folks who might be listening? So switching the order a little bit, Jennifer, going to start with you. What are some of the common challenges that you find when navigating government partnerships?
Sure. So at ICF, we serve federal, state, nonprofit, commercial customers at the federal level, which is the largest portfolio of our public services work. It follows the FAR, the Federal Acquisition Regulations, and the FAR is really good. I'm not anti-FAR by any stretch. No trash talking on the FAR. But the bottom line is it really doesn't support the way we work these days. It doesn't support agile project management or software development. And it doesn't really support things like the pandemic. Like we never really had, this kind of black swan event in our lifetimes for us to support. So my point is we need to move quickly and pivot on a dime. We're stuck with a contract or waiting for something to kind of go through the pipe. So it's difficult to be reactive in a way that is really helpful and impactful. My advice on this is really thinking about every single one of your customers, your customer's customer, and including those contracting officials and acquisition staff as those customers. You have to have those relationships too. And really encouraging a collaborative conversation about how we're going to bring a solution to government. At the state level, it's kind of tricky too. I mean, there's 50 different buyers with 50 different territories buying systems, processes. And again, it comes down to the relationship. So my advice here is pick 1 or 2 states where it makes sense. I love Nicole's like, yeah, I cover North Carolina and this is what we do. It's very difficult to be in all 50 states. Make that alignment to something where you already have existing local partners or an employee base or those deep connections to those government officials.
Great advice. Pablo, throwing it over to you. What are some of the challenges you face with government partnerships, and what advice do you have?
One of the main challenges that you often face with government officers is that there are many different officers in many different agencies with very different motivations and mandates, and many times they don't speak to each other. So the main issue is that you start working with an organization trying to resolve an issue that's already being addressed by another organization, even sometimes within the same unit. So one of the key elements for us is trying to identify who those potential stakeholders might be and trying to bring them together, because otherwise it's a waste of resources, a waste of time, and the like. So that's one very important one for us, but it's associated with the nature of the public sector, right? The public sector has an incentive structure that's very different from the private sector and even for the not-for-profit, right? And so it's responding to the average problem as opposed to the individualized problem. And sometimes our solutions are mostly found at the individualized level. So that's one. The second, and third one are associated with the relationship between academics and practitioners. And the main issue is an issue of time horizons and the value of certainty. And so we as academics, are in the world of uncertainty. And so for us, everything is probabilistic. And that doesn't bode well with a person who has to make a decision and wants certainty behind those decisions. So the way we navigate that process is saying okay, let's find each other midway. You know what you want to do, and you think that this program is going to allow you to resolve that problem. So the best way we can do this is let's try it out. Let's do a project evaluation. You know that resources are limited, so we might as well do some form of an RCT or a design project evaluation that allows a limited rollout that helps you assess the effectiveness that you believe the program has and adjust as you roll out completely. So the main issue here is identifying where and how we can align those, the penchant for certainty, and the need for fast and clear answers with the idea that people who are at the cutting edge of starting these processes are, have more uncertainty, and I would like to have more time and data and resources to be able to give a definitive answer.
Yeah, that makes sense. So slightly different challenges. Dr. McKinney, so we're turning it over to you. Do you have anything to add to the government challenges and advice that the other two panelists have talked to?
Yeah, I think, for our type of work, our engagements typically range anywhere from about 2 years to 6 years. And so for any given state, one of the biggest challenges I think we see with the government is just really by virtue of the change in administration, it can inherently change a lot of the project scope. So if the annual goals, the budget, the administrative staff, the priorities have changed, that then by virtue impacts our work. And so I think that's been one of the biggest challenges. And so the advice there is just to really keep a strong pulse on the policy landscape, really understand where pivots are happening. And then I think I have a lot of similarity with you in regard to the pandemic. And Jennifer, because we're working with hospitals and health centers, clearly this world crisis has impacted our line of work. And so what we've realized is that we really need to meet our partners where they are and really understand and have a really strong pulse on what their capacities are. So again, advice on that level would be just keeping really open lines of communication to know when there's opportunities to pause, to reflect, to pivot, to change, but just really meeting partners where they are and understanding the landscape that you're in as it continues to evolve.
Yeah, and I want to just follow on to Pablo. The understanding the disparate stakeholders is the really big thing, right? And we see this coming out of a lot of federal procurements where we have not seen this so much in the past. And I think it really is spurred by the pandemic, Nicole, to your point. HHS has a lot of opportunities and big initiatives. Big dollars, $50, $100 million, where they want to see teams come together that are academic institutions and nonprofits, and they want to see representation by historically Black colleges and universities, which is awesome. We're working with Morehouse College of Medicine on vaccine hesitancy right now, something that I know Civis has done some really great work on. And one of the challenges, we're not even on this, there's not one common even operating system. There's not a distribution list. If you're on Zoom and I'm on Teams, how do we even communicate in a virtual environment, much less figure out where we have that common vision? And often when I start these projects and at kickoff, I start these big kind of Venn diagrams and figure out, okay, where's that one place, that sweet spot in the middle where we all align? What can we let go of? and what can we really focus on? And getting some early wins, I think, really helps to establish buy-in with all of the stakeholders.
Yeah, no, that's definitely some great points. And I think we've all had to adjust to distribute a workforce. I guess any sort of other insights, either from Pablo or Dr. McKinney, on how the pandemic or like having a workforce all over the place has impacted partnerships. I know everyone, you both mentioned the need to adjust and meet government where they are. Is there any sort of other lessons you think we can learn from that?
In some regards, I think for our relationship with government, the pandemic has helped because you don't have to meet in person. And it's like to make things happen. And so at times it becomes easier, that communication, of love communication, but it breaks one issue that we also see in the classroom and working with our own teams within the university, which is that in person-to-person relations, you build a completely different rapport. And again, it's like technology is fabulous and allows to do stuff that we wouldn't do. It's like otherwise. But sometimes the person-to-person relationship helps. Identify where different actors are coming from. And some informal conversations help you review some of the potential tension that comes about when you're just in these non-personalized ways of interacting with each other.
Yeah, I just add one thing. I think, again, Jennifer, something you said really struck for me. It felt like you were really kind of talking about infrastructure. And I think one of the lessons for us too was, one of our main interventions has been a training, curriculum that we deploy. And it was in person, 8-hour in-person training that we quickly had to convert to an all virtual setting. And then some of our coaching and technical assistance, we also needed to convert. One of the things that became very apparent is that there were degrees of separation with just baseline technology, ease of access and ease of use. And so for many of our partners here in
we haven't talked about rural broadband yet, but I know you got that going on too. I was
just about to go there. Many are urban, but there are many that are super, super rural. And for our line of work, we have these contraceptive deserts. And we really just kind of took for granted that some people weren't even used to connecting on a Zoom platform. And so there was a lot of, additional TLC, if you will, that we have to do from a technology standpoint, just to really bring everybody at the same playing level to be able to even, really collaborate effectively and communicate in a way that was going to be meaningful to both sides. So technology in itself at its most basic core level became really a paramount topic that we had to focus on.
And the thing I always come back to is, I don't know about y'all, but every time I had one of those dark pandemic days where I'm like, what? I don't even know what day it is. I hate everything. I hate my family. I hate my job. Like I made a list on my fridge of things that I hope stay after the pandemic. One of them, DMV appointments, like try and get 2 teenage boys through the DMV process. But
yes.
The appointments, let's keep those. Okay. So it's an opportunity really for us to think about all citizen services. What does every interaction between citizens and government look like? And can we do better? Yeah. And for years we've been told, oh, all of these things must be done in person. I'm so loath to give up my passports, which are expired and need to be renewed, but it's an in-person review and they only have a third of the staff reviewing them right now. So the wait time is like 16 weeks. So how do we, going forward, set up to continue to deliver services to our citizens in a way that isn't a distributed? Because there is no before times. Like this is just the way we work now. There may be some hybrid, but this is the way it's going to be.
This is the new norm.
Yeah, but the flip side to this, which is for government and the relationship with the individuals who are recipients of some of the policies, is that some of those who have challenges accessing technology fall out of the system, right? And so it's hard to engage. It's like the needs, for instance, right? In Houston, in February was a big storm. A winter storm that took out electricity and wiped out for several days. There were many organizations trying to reach out, especially to elderly people, bringing food to their homes, right? And so some of these organizations were pretty good at contacting those in need. But there was a large number of others who would not contact. And by looking at census and other data, you knew that they were there, right? But there was no way to approach them, right? Because you couldn't go door to door. It's like there was no other ways of canvassing. There were no surveys of underserved populations who tend not to answer the phone or have access to broadband to respond to surveys and so on. So there, I mean, it's like it creates a challenge in terms of the delivery of policy, not so much on organizing the teams that would be able to design and implement those policies.
Yeah, no, those are all great points. It sort of segues into my next question, and I feel like we touched a little bit on this, but how do you think private companies can work with government to enact the executive order on equity, or just dealing with issues in this case, because we're talking about data equity?
I love this so much, and I'm so glad to see it. One thing we've been talking about is, in order to make really big moves, particularly in public health, we really need to leverage things like artificial intelligence and machine learning. That works well on really complete data sets, these supersets. It doesn't work well if you're not including, if the data's not clean, if it's not inclusive. And what does inclusive data even mean, right? So a health system maybe that Dr. McKinney is working with may have EHR or health records. They may not have the Catholic Charities run Spanish-speaking clinic records from the corner health clinic. They just might not be digitized. So how are we including data? And what does a complete data set look like? What is inclusive data? Because I don't think we actually get to health equity without taking a hard look at that.
Yeah, I'm just going to say, and then just adding on to that, the interpretation of data is also pretty essential. I have just been amazed here lately at how folks are just interpreting and synthesizing data in a way that creates such diverse thought, to put it nicely.
Well put. Pablo,
I do have a comment about this, and I think I understand where the executive order comes from. I mean, equity and access to information about programs is very important. We did some work with the Austin Chamber of Commerce last year, a survey of their members identifying their needs and particularly access to PPP, the Paycheck Protection Program. And we found that, as you could imagine, I mean, it's like minority-owned businesses, women-owned businesses, and businesses in some neighborhoods in Austin had no access to PPP. Right, they couldn't navigate the system. They didn't have contact to the banks that were rolling out, and so on. And the key there, I mean, the ACC stepped in with the other chambers of commerce, represent different organizations, were able to design, I mean, how Austin would roll out. I mean, I worked with the Small Business Administration to roll out the second wave of PPP, and there the holes were, I mean, more limited. Now, there's a bad part of this is some of those holes on inequity in access to rescue resources might have been because the ones who are hit the hardest were the minority-owned businesses that went out of business earlier than others. But there was also some effort that helped them step in. So the conclusion from this is just reflects the idea that the private sector does some things very well, but it fails at others. The public sector does some things very well, it fails at others. There's a large component which we call the social economy populated by not-for-profit organizations. I think they are the key interface, I mean, to help in these private-public partnerships. Now, they tend to be organizations that operate in areas where neither the public nor the private sector are responding for different reasons and incentives that they face and so on that we discussed before. So they tend to target populations that are not directly served, I mean, by access to private resources or public programs and so on. But they have a limitation, which is access to resources. And and they wind up spending more time trying to get the financing and fundraising for their activities than for actually deliverable of the projects that they want to work with. So I do see these organizations who have a direct contact with the individuals and groups that are potentially the recipients of our efforts from the public sector to work as an interface between the private and public sector. And I think we can play a very important role in that.
Right, you're talking about the PPP and how hard it was to get those loans, right? That one of the interesting interpretations, and part of that equity order is 1435, I can't remember, is reducing the administrative burden, particularly on disparately impacted populations, right? So how do we get rent, tenant assistance to people who are being evicted. Like, how do we actually get that down there? Because it's so complicated. So we are having lots and lots of conversations with all of our customers, IRS, Patent and Trademark Office. Like, how do we increase accessibility and inclusion in just accessing normal everyday government services? And I think we're in this moment in time where we have an opportunity to rethink the entire process. So not just that citizen web interface, right? That's what you think of, but the whole process. Like, this is a time to relook at what made sense for PPP. Like, they got a lot of money out the door as fast as they could. Never really done anything like that before. So, okay, IRS was already remote. They didn't really have the resources, but if we do something like this again, how do we do it more efficiently?
Dr. McKinney, any insight for you on I'm going to ask the question a different way. If you could wave a magic wand and have government just do one thing better to help with this issue, what would it be?
Yeah, so I don't know if it's truly doable, but if I had that wand, I think it would be, one simple thing that I think I've experienced historically, even beyond this role that I'm currently in, is the lag of data, LAG of data with government. I know we're harping kind of on this pandemic, but I think about how quickly we were able to track in real time across the world, vaccination status. And I just think about, some of the billing and claims and different facets of information that really carries like a 90-day plus lag time, and how that can impact funding or lack thereof because you don't have real-time data. And so, like, I know, one of the things we've been interested in understanding is how can, private nonprofits support that. And for us, we collect a lot of topical information that can sometimes augment that. But the lag time, if we could like just wave a wand and speed that up and expedite that, that'd be fantastic.
Yeah, that's a good one, especially when you see the old saying, when there's a will, there's a way, because when we're motivated, that lag time does dramatically decrease.
Yeah, and PPE is a perfect example of that also. So good point, Pablo.
Okay. I'm going to just jump to, trying to wrap it up here. We've had some great discussion. And I think, I don't know, whoever wants to jump in to take this one, but I'd like to hear from everyone. What advice would you give to private organization that's partnering with the government for the first time?
It's a little controversial, but if you've never worked with particularly the federal government, go in as a subcontractor first. Priming and working directly as the interface is really tough. It requires a lot of infrastructure that you have to invest in, and you may be not sure this is the customer segment that you want. So going in, trying it out, seeing if it works for you. There are a lot of great things about working for the federal government. I mean, you have the opportunity to change lives, save lives, make really big impact. They typically pay their bills on time. All these things, Prompt Payment Act is good for small businesses. But the barrier to entry can be very large. And I think finding ways to work through their small business offices, they call them OSDBU, Office of Small and Disadvantaged Business Units, at each agency is a good place to start. And the SBA also has a ton of great matchmaking programs. There are also some programs through SBIRS or Small Business Innovation Research that are good entry points to test it out at a small level.
Okay. Dr. McKinney or Pablo, any advice you would give to someone who's partnering with the government for the first time?
Yeah, I was going to say, this may sound pretty elementary, but whether it's local or federal, I think one of the most basic things you can do is just really understand the environment. Like, obviously, the trigger word that is a bureaucracy, it's true, but some of that is unnecessary, but some of it's very necessary. And so understanding, I think, what their guardrails are, what their parameters are, and then just understanding structure. Like, it varies depending on the state, depending on the entity of the government. And so really having a strong understanding of how that's organizationally tied together, and what motivates and drives them, like what's their real, what's their secret sauce and what's their motivator, I think would be a very good foundational place to start.
Dr. McKinney is a fabulous point. I mean, it's like, which comes up to this issue that be prepared, understand. I mean, it's like what the organization is trying to achieve. I mean, it's like, what are the resources available? And also be patient. I mean, it's like, so that's a key element. So this is the government is not the private sector. It's probably closer to a public company where there are many, processes and regulations, right, that you have to follow before you can make a decision. So it's very different from our daily lives where we, decide how to move based on our own will. So identifying and understanding that, to me, is key. And if you're patient, if you do your due diligence and you understand what the program is about, what they're trying to attain, what are the constraints and opportunities they face, then you'll figure out that those are issues that are more easily navigated. The main hurdle to these that I find is that in many instances, as I mentioned before, the decision makers within the government agency already know what they want to do. And so it takes some communication skills to persuade them. That perhaps relying on your expertise, and your abilities might be more helpful to achieving, whatever it is that they want to do.
I think my number one piece of advice, though, is to understand how they buy. Like, you really have to understand the federal acquisition process and the lingo and how they're going to acquire you. Make it easy. And there is a huge shortage of acquisition staff in the federal government. Every state acquisition office I have says it's broken. We can't get this through. I mean, do you know that the states have only spent 2.5% of their CARES Act money? 2.5%. Like, it's stuck. Like, we need to give our customers the easy button for them to hire us to do the work. It is not their fault. There's just not enough of them. This is sort of money at a scale and a speed that we have never seen in a disaggregated environment. So the states have a really big opportunity here. They have till 2024 to make a plan and 2026 to spend. So let's create the easy button, figure out the way, write a white paper, suggest the contract vehicle, make it easy for them to hire you.
I love that.
Yeah, that's excellent advice. I mean, I also would add, I think you do need some patience. You really need to understand that as much as you communicate and figure out the stakeholders and think you have a plan, something comes in that you weren't expecting.
Easier said than done.
And then we're sort of back to remaking another plan. So I think having the long view and having that patience and saying, okay, this is just a roadblock, we'll get through it and on to the next roadblock. No, that's really great and really helpful. I'm just going to see, we do have a few minutes left, not a lot of time, but just checking to see if there are any questions or anything anyone listening has a burning desire to ask our panelists, really knowledgeable panelists from 3 separate areas, 3 different types of partnership with the government. So if there's any questions, we'll love to hear them.
We actually do have some questions, so certainly want to thank everyone for sharing their knowledge and expertise thus far, but we do have a couple of things in the hopper here. And the first one is, this may be a simplistic question, but how can we know we need to partner before it's too late or we're in over our head? Pretty broad, but I guess essentially is, when's the right time to partner?
I mean, that's a real good scope discussion. And that comes from customer intimacy, really knowing that customer, whether it's a health system, a nonprofit, the federal government agency. What are they really trying to do? You're the expert. They're hiring you. And you have to sometimes say, whoa, you think you're going to do this for $500,000? That's not going to cut it. Here's what we need to do. You need to change the scope. Let's down select, present the risks, show where you can bring a partner in. And really making sure that if you're talking to a partner, it's win-win for both parties in this partnership. It has to be structured in a way that benefits both.
Yeah, I absolutely agree. And I was just going to say, just ask the question. I think that's one of the things that we found to be just helpful, is just to sit down and ask the direct question and allow them to float the input to you to help you craft what's needed.
Right, excellent. This other question kind of goes back to this whole idea of PPP. And it says, what about PPP in the infrastructure construction space, which has a direct impact on, well, this is pretty long, which has a direct impact. Would Would love to get the panelists' thoughts on how data might help.
You know, I think anytime that you can prove on the, I mean, I don't know the angle of the question, but as anytime you're embarking in a new partnership or new structure, having the data to prove that it was value add helps you get more. It helps to make sure you're managing your reputation well. It helps to grow your pipeline of business and ensure stability and resiliency in your organization. You have to have the data and the story.
If I understood the question, I think the key element here is identifying that most of the stuff that the government does, it does it indirectly, right? Through the power of the purse. I mean, not directly. I mean, it's like, except for healthcare through the VA and some of and defense, for instance, right? It's like, and maybe in some areas with education, it's all indirect type of activity. So if you're going to build a road, I mean, it's like you hire a constructor, and it's like and you go out for bids and the like. So the key element here is that we're dealing with public resources, so there are a lot of, I mean, it's like rules and regulations aimed at making sure that there's no misuse of public resources that results in some restrictions that actually screen out many potential partners that are not able to pay those fixed costs, right? I mean, adjusting their behavior to being eligible for those contracts. So I think a good way of solving this issue would be to creating consortia of different types of private organizations that are able together to bid for some portions of the contract that individually they would not be able to do. That would be an important part. But again, I mean, it's like it also happens in the private sector. When you think about it, it's about large organizations and the restrictions they place on the activity of the managers and the employees, not to take advantage of the money that belongs to the shareholders, right? It's like and the investors, right? So whenever you have a large organization, you spend lots of resources in management, and those resources result sometimes in red tape, both at the public and private sector. Identifying that, I mean, it's like would create, I mean, require some creative ways. But again, I mean, the time horizons work differently. I mean, it's like, and that sometimes makes it really hard. So I keep telling my students, for instance, that one of the reasons why we have to, I mean, it's like, in order to prevent money laundering, each time you travel abroad, you have to declare, I mean, it's like any amount of money over $10,000 that you, I mean, move. Most of us are not engaged in money laundering, but it results from regulations aimed at tackling a very specific issue, right, that winds up having an effect on our daily behavior. Again, I mean, it's like somebody trying to blow an airplane forces us to spend an hour in line at the airports, right? It's like to try to prevent that from happening. So all these issues are at play, I mean, in the relation between the public and private sector, that are not exclusively about being private or public. It's about the managing, I mean, it's like areas where there's agency involved.
Excellent. Well, with that, we are at the end of our time. Certainly want to thank you all for sharing your knowledge and expertise. Any closing remarks before we end the session today?
I just want to say thank you for the panelists. It was great. What a great discussion. I'm really thankful for you making the time to attend.
Thank you as well. I enjoyed it.
Yeah, thank you for the invitation. It was great meeting. I mean, it's like Jennifer, Nicole, and Claire and you, Patricia. It's like,
likewise.
We got some big problems out there. Let's go solve them.
And pull out that wand.
You're right.
Thank you.
Okay. Thank you so much.
Bye-bye.